mynews.studio.
Picture this: a child in Cameroon rolling up their sleeve for Africa's first routine malaria shot. Could this moment actually change the course of disease history on the continent?
Today is October 23rd, 2025. Cameroon making malaria vaccination routine for children. That's a big move, right? It's the first time any country is taking the malaria vaccine from a pilot phase to a full national rollout.
Yes, absolutely. Malaria has been a leading cause of death for children in sub-Saharan Africa for decades. With this new program, Cameroon's aiming to immunize millions of kids. Did you know over 600,000 people die from malaria each year, and most of them are children in Africa?
That's a huge number. How effective is this vaccine, though? Are we expecting a big drop in deaths, or is the impact more gradual?
The current vaccine, RTSS, reduces severe malaria cases by about 30 to 40% in children. It's not a total shield, but when you combine it with other malaria interventions, the impact adds up. At scale, hundreds of thousands of lives could be saved each year.
Rolling out a vaccine like this can't be straightforward, especially in areas with fewer resources. How did Cameroon handle getting doses to really remote places?
They took a blended approach: fixed-site clinics, outreach sessions, and mobile vaccination units. The 42 districts with the highest malaria rates were targeted first, especially in the far north and north. Mobile teams actually traveled to villages that are hard to reach. Plus, the expanded program on immunization put in a digital system to track vaccinations.
That digital system, given the region, I'm guessing data connectivity must be a hurdle. Is it working well?
It's still being worked out. There are issues: data gaps, patchy connectivity, especially in remote areas. But moving to digital does help with real-time tracking and responding faster, which is already better than relying only on paper records.
What about hesitancy? In some countries, rumors and mistrust make vaccination drives tough. Did Cameroon run into that?
Definitely. They saw it coming. The government focused on targeted communication, meeting people in their communities, sharing stories from parents whose kids got the vaccine, and framing it as just another standard shot in the child's schedule. National surveys showed about 91% acceptance, but there were still doubts in some areas, mostly around safety and side effects.
Did any misinformation take off, or was the response mostly united?
There were some negative rumors, but early data shows strong uptake and mostly positive attitudes. The difference maker was really ongoing, direct communication, and making sure messages came from trusted local voices.
Other countries must be watching. What's Cameroon teaching the rest of Africa? Any lessons already becoming clear?
A few things stand out. First, folding new vaccines into existing programs builds trust. Second, good training and support for health workers is vital. They need to feel prepared. Third, outreach has to be tailored. What works in the capital won't in a remote village. And solid data management is key to track who's getting left out.
You mentioned 17 more African countries rolling out malaria vaccines this year. Will they face the same roadblocks, or are there new obstacles ahead?
They'll see some of the same challenges: distribution, hesitancy, data issues. But each country's health system is different. Ongoing international support for vaccine supply and funding will be crucial. Cameroon is being seen as a model, but each rollout will need adjustments to local realities.
If we zoom out, why does this story matter beyond malaria? Is there a bigger message for global public health here?
It's really about scientific progress reaching the people who need it most. It shows that with the right coordination, local leadership, and global backing, even ancient problems like malaria can be tackled. And it could inspire similar efforts against other diseases, which could shift child mortality rates overall.
And it underlines trust, data, and tailoring solutions to local needs. So, do you think Cameroon's model could shape the future of tackling infectious diseases in low-resource areas?
It's a promising beginning. If these lessons are built on, the results could be significant. But the real test now is keeping up the momentum and making sure everyone is included as the rollout grows.
So today, a child in Cameroon gets vaccinated, and that small step could send ripples across the continent, maybe even further.
Exactly. Thanks for listening as we unpack this story and its wider impact.
Thank you for tuning in. This episode was brought to you by mynews.studio. Give it a try for free.